My name is Tobias Bauer and I head up Dr.Oetker's activities in South Africa. Being in the food industry in these times brings its own set of challenges, be it supply issues, exchange rate effects, or new requirements to stem the spread of the coronavirus. Where activity in the retail space, which consists mainly of frozen pizza and ready meals, remain unchanged, our food service business, which consists mostly of frozen cakes and desserts, is still largely non-existent in the current level of lockdown. We realize the urgent need to adjust our business approach by taking into account permanent changes in our markets going forward. While there was some uncertainty at first, this has led to an even greater sense of team spirit. We based our approach to the coronavirus outbreak essentially on the guidelines provided by the government, WHO recommendations, and our internal group standards. This being primarily the implementation of additional hygiene and social distancing practices. We recognize that while hygiene is second nature to us as a food manufacturer, we had a lot more to do with regards to social distancing. This is especially true in South Africa, a country that has a very social and interactive culture. Being able to make a plan is something that is inherent to us, especially dealing with difficult situations. Because masks were not available or reserved for frontline workers, we developed a simple model internally and are producing our own masks as we speak. Further to this, we try to visualize the required social distancing to our staff by cutting a couple pieces of PVC pipe to 1.8 meters and asking our staff to walk around the factory without running into things. This obviously greatly lifted the spirits, also after our own managers tried to do it too, but also enabled us to identify critical points in our production. To help mitigate the effects of a lockdown on our food service business, we took advantage of a program available through the UIF, the so-called COVID tours. We encountered no issues when claiming and found the response times were good. In these challenging times, it is impossible to give a meaningful outlook. A couple of things are pretty sure though. Firstly, there is no after Corona. Until we find a vaccine, the restrictions will have to come and go. Secondly, we are possibly looking at a dramatic change in consumer behavior. The coronavirus acts as a catalyst to drive developments that were in progress faster, for example, e-commerce or the health trend, but also creates new ones, for example, changing the travel industry or perception of hygiene. This leaves us with the opportunity to reshape the way we live, travel, and interact. I find it encouraging that we have managed so far, with our limited resources in South Africa, to find a way to deal with this pandemic. Let us keep engaging and continue to find our way in this crisis.